Well, welcome back to the podcast, Exploring the Depths of Healthcare. I'm your host, Ben Imes. Thanks for joining us again. We've got really awesome guest today, Melissa Sunderman. I want her to introduce herself and get to know her a little bit better today.
Thanks. Well, thank you for having me here today, Ben. Super excited. So, like Ben said, my name is Melissa Sunderman. I am a physician. I am double board certified in both internal medicine and lifestyle medicine. Been practicing medicine for going on, oh my gosh, almost 30 years. I've been at this for a
Whoa.
long time, but I've had lots of pivots. I'm full of curiosity and I'm a lifelong
Yeah,
learner. So, my career has been really fun and I've worn a lot of different hats. So I've worked for large healthcare systems. I've
sure.
worked for universities. I've worked for concierge practices. And I'm really all about trying to elevate and optimize everyone's health and well being so they can live their best life. And I try to preach what I practice. No one's perfect, but if I'm going to talk the talk, I really want to walk the walk, or usually in my case, run the run.
Run the
Um,
run. Yeah, I was going to say.
and just fully experience this myself so that I'm better able to translate it for my patients.
Yeah, I mean, you've had a wealth of knowledge probably built up over this career. What specifically have you kind of followed in on and kind of honed in on as your specialty and kind of your niche in the healthcare realm at this point?
Right. So I think that started a long time ago. As I said,
Mhm.
I'm internal medicine, primary care. And early on in my career, I was always curious about really what entails being healthy, right? And I
Right.
really wanted to be a healer and offering tools for my patients. And I found that that was going to go beyond conventional medicine. Now, I'm a DO, doctor of osteopathic medicine. So, from our original training, we were thought
Yeah.
to think about the body as an integrated system. And I've just taken that full force. So, way back in about 2007, when I was working at the University of Michigan, I had the opportunity to participate in a faculty scholars in integrative medicine year long program. And so that
Mhm.
opened my eyes to so many ways of healing, whether it was naturopathic medicine, traditional
Mhm.
Chinese medicine, energy medicine. And all of a sudden, my myopic view from
Yeah.
medical school opened up my lens. And from there, I went to do a professional training in mind body medicine through the Center of Mind Body Medicine with James Gordon. Incredible. And this is way back,
Wow.
almost 20 years ago. I can't even believe that. It was
Wow.
very much early on. And so when I would come back to my healthcare system there said, "Oh gosh, she's just a little bit of an oddball, a little bit of a unicorn, a little bit of an outlier." So I
Mhm.
always kind of felt like that until 18. My kids were going off to college, so I felt like I had a little
Yeah.
bit more time professionally to really dig deep and figure
Sure.
out my pathway. And that's when I discovered lifestyle medicine, American College of Lifestyle Medicine. And when I read what it was all about, it to me was like coming home because it was
Yeah.
everything that I was trying to do for myself and all of the tools and evidence behind it and a whole collection of professionals that
Yeah.
believed in the same thing. So I became board certified through the American College of Lifestyle Medicine in lifestyle medicine in
Right.
2019. And ever since then, that has been my passion. That is what I've decided to really
Yeah.
hone in on as far as my career. And I'm having a blast. And I have to say, like, I am 55 years young, I will say.
Yeah.
And this is just testimony that your career, if you are doing what you love to do, it can just begin in midlife, right? And so I feel
Totally.
like opportunities, I'm showing up authentically. I have found something that so aligns with who I am as a person, and
Yeah.
it feels really, really good.
You found it. I mean, it's just a testament that if you just continue looking, obviously there's an initial impetus to go into healthcare, but I mean, if you keep looking, you're able to find out what actually makes you tick and you're excited to get up in the morning and to continue.
Absolutely.
You're not as tempted by burnout as every other physician in the healthcare field.
Yeah, and that takes courage. Like it really does. It takes courage to say, I want to go down a slightly different
Yep.
path.
Yep.
And maybe I'm the first one to sort of go down this trail. And there's not really a trail marker. I know that you're a big outdoors person, so am I.
Yeah.
And oftentimes we're looking for our trail markers or our piled up
Yep.
rocks, right? To know
Yep.
which
That's
way.
all it is sometimes.
And sometimes it's like, I think I'm going in the right direction. This feels right. And I'm just going to keep going this way because I believe in myself and trust my intuition. And that's sort of what my pathway and career has
Yeah.
been.
Yeah. Now, how does one so I've had a guest before and my listeners will know like about longevity medicine. There's some probably parallels with lifestyle and longevity medicine, but what specifically are you implementing in your practice and kind of what you're doing with your patients? Is it reactive versus proactive, kind of treatment, or are there other things that you're kind of doing?
That's a great question. And so funny you say bring up longevity medicine. I just returned from Geneva, Switzerland last week where I was speaking at the Global Longevity Summit. It was incredible.
There you
And
go.
people will hear the terms lifestyle medicine, longevity medicine, integrative medicine,
Yep.
functional medicine.
Functional.
I like to think of that as like a Venn diagram. And
Sure.
there's a lot of overlap, right? And then maybe some nuances on the side. Like functional
Right.
medicine tends to do a little bit more supplementation. Longevity medicine, we get into some really cool things on the forefront of stem cells and peptides
Yep.
and
Yep.
exosomes, and then integrative, utilizing acupuncture and Reiki, and then lifestyle medicine. So, lifestyle medicine really acknowledges that about 80 to 90% of chronic diseases, so chronic diseases being high blood pressure, high cholesterol, type 2
Mhm.
diabetes, insulin resistance, obesity, and kidney disease, that these are really related to our underlying lifestyles. So if you go
Yeah.
and talk to anyone that says they're a longevity physician, functional, integrative, or lifestyle, they will say that foundationally, 80 to 90% of your health and well being are going to be food, nutrition, how we nourish our body, how
Yep.
we move our body and exercise, how we sleep and prioritize getting
Yep.
restorative sleep, how we manage our stress, how we avoid risky substances or risky behaviors that don't serve us, and how we connect. So connecting
Right.
to self, sense of purpose, community, and
Right.
then I like to talk about connecting to environment and nature. So I think
Yeah.
that's where the commonality is. And actually, at the Global Longevity Summit, the researchers and the speakers there were global leaders in longevity. I learned so much. And
Wow.
I spoke about the foundations, right? And
Yeah.
how important these are. And in my current role, I'm medical director of lifestyle medicine for Corewell Health in Michigan. I live in Ann Arbor, Michigan. Corewell Health is the largest healthcare system in the entire state of Michigan, about 23 hospitals, 66,000
Mm,
employees, robust. And I am the medical director of the lifestyle medicine program there. And so I
right.
shoot pictures. We have a robust teaching kitchen. We've got nutritionists. We've got health
Wow.
coaches. We do shared medical appointments where we actually put people through fasting mimicking diet protocols. We teach them
Wow.
how to cook. We bring them up to our kitchen and teach them how to cook. So we really are taking this to a whole new level because so often individuals, including myself, we know what we should be doing. We
Yep.
know why we probably should be doing it, but it's the how. Behavior
It's
change
totally
is
the how.
really, really difficult. And that's
Yeah.
why gyms are packed on January 2nd and usually empty by February, mid February, right? Because
Yep.
it's very difficult to create sustainable, healthy lifestyles.
Mhm.
And that's the job I'm in, is really how to
Yeah.
empower and partner and support and cheerlead individuals to create these healthy behaviors because once you adopt them, it feels really good. And so you
Mhm.
want to keep doing it, right? I'm sure that each and every day you probably get up and think, okay, like I'm going to, move my body in some capacity, or I'm going to go outdoors, or I'm going to fuel my body with healthy food because you get the return, right?
Yep.
It's like just we invest our money because we know that the rate of return is really pretty
Yep.
good if we invested it in the proper way and we start investing when we're young. So the same thing, if you invest into these pillars of lifestyle medicine, I guarantee you're going to get a very good rate of return.
Yeah. And I mean that brings so many other questions and also just curiosities from my standpoint and probably from the listeners. It is about the how. I mean, that's very, very clear from what you're speaking about in terms of how all these but also how these other specialties kind of support each other, but use lifestyle medicine as kind of the basis.
Yes.
But the how seems so difficult depending upon, like, you can't be in somebody's life as much as, there's only so much you can control, right? But what resources that you're able to supply or you're able to kind of recommend to help support the patients that you're seeing and support the people who are active in their own healthcare and actually desire to improve their lifestyle, right?
Yeah.
They don't want to be on meds anymore. I think what's incredible to me, and I'm just tangenting a little bit, is I did my whole capstone project in grad school about lack of nutrition education in med school and PA programs. I think
Mhm.
it's about maximum data that I was finding was about a week's worth
Yeah.
of
Say
nutrition.
about 17 hours, right? And that was
Yep.
when I went to medical school in 94 to 98. And I don't think it's
Right.
really changed too much since
It's not changed. I can confirm. My capstone proves it.
Yes, and yet, if you look at any physician's note when, we have EMRs and
Yep.
everyone will say, "Eat a healthy, diet and exercise," but yet we don't even know what that means a lot of the times. I
Right.
mean, I do now since I got board certified in lifestyle medicine, but beforehand, we'd say this jargon, we'd type it in our EMR, and
Yep.
yes, it didn't work.
Lifestyle
Or
modifications is lifestyle modifications is a massive component that we preach, but
yes.
we kind of just say, okay, we'll go float by yourself and figure it out.
Yeah.
How do you find yourself kind of navigating that complexity and helping the patients kind of get connected to that?
Yes, and I'm so happy you're bringing this up. So when I am seeing patients, I say I am one cog on a wheel. Like,
Yeah.
yes, I'm the physician. And so often in healthcare, it's like the physician, and literally my role is, I don't want to say it's insignificant, but because it is, it's significant. And I have to work with my nutritionist team. I work
Yep.
my culinary medicine team, which we have chefs. I work
Wow.
with, and then health coaches, invaluable, like health coaches for behavior change. We wouldn't have the success without them.
Right.
And when you talk about, yeah, we can't, like, we're not going to move in with you, but, just creating SMART goals, right? So these are very specific,
Mm-hmm.
measurable,
Mm-hmm.
attainable, time bound, relevant,
Yep.
personalized goals. So rather than saying, "Hey, Ben, um, I want you to eat healthier," it'll be like, "Okay, so I go through, like, tell me about, like, what your dietary patterns look like. What do you have for breakfast, snack, lunch?" I mean, I ask all these in depth questions. How many
Right.
servings of fruits and vegetables are you getting? Are you doing any beans? Are you doing any whole grains? And then we've created like a whole document that is populated with hyperlinks. And so, like yesterday, when I was seeing new
Okay.
patients, I'm like, "Oh, you're not really getting any whole grains. Do you like oatmeal?" They're like, "Yeah, but I usually don't take the time to make it." I said, "How about we give you some recipes for overnight oats? That way you can meal prep on Sunday. Just get some mason jars at the dollar store. You'll make overnight oats.
Mm-hmm.
You'll make 5 of them. You'll put them in the refrigerator. And then every morning you just grab it on the way to work. And if you don't like it cold, you can heat it up." And I pop in a hyperlink, and we
Yep.
will be very specific. Like, maybe they will only do that 2 days a week. So it's like, okay, what days of the week do you want to do this? When are you going to prep it? Like, what time of day? So the
Wow.
more specific we get, and then we always ask about level of confidence. Like, how confident are you that you can accomplish this goal on a
Right.
scale of 1 to 10? And if they're not at least at a 7 or 8 and that level of confidence, then we back it down. Like, okay, how
Right.
about you just open up the hyperlink of overnight oats and look at the recipe and maybe go to the grocery store and get the ingredients. And then the
Baby
next
step.
next time we meet and you meet with your health coach, why don't we maybe talk about actually making the overnight oats? So
Yeah.
again, it's just really starting small. And I often say to my patients, aim to just be 1% better. Like, this does not have to be this huge change. So often we get into this black or white, all or nothing thinking. And when we aren't able to accomplish what we set forth to do, we give up. Right. We
Mm.
just give up and we say, "Yeah, okay, I didn't do it. So I'm defeated." So,
Right.
so it really
Discouraged.
is about highly personalized and spending more time with patients. So my new patient appointments are 40 minutes, which is
Yep.
much longer than when I was a primary care physician. Oftentimes our appointments were 15 or 20 minutes, regardless if it's
Oh.
new or established. And you just can't get through, like,
Mm-mm.
any sort of education. And how when I have new patients, and I do both in person and virtual, we're
Okay.
very much have leveraged virtual appointments. So that means that I can see patients anywhere in the state of Michigan. And then I've got medical licenses in 8 other states. So I can see them. And then I will message one of my health coaches and I'll say, "Hey, can you pop on the call?" So I'll do what we
Sure.
call like a warm handoff. And I'll say, "This is what, Judy has been struggling with. And we talked about areas that she could improve
Sure.
in this area. Could you set up some SMART goals with her?" And then I log off and go on to my next patient, and the health coach will take over.
Yeah.
We really are just really wanting to give our patients the best chance of success, right? And not give
Yeah.
up. I remember that when I was studying for my lifestyle medicine boards way back in 2018, I was at my office and
Mm-hmm.
colleague said to me, like a physician colleague said, "What are you doing?" And I said, "Oh, I'm going to get board certified in lifestyle medicine," and told him all about it. And he said,
Yeah.
"Why are you doing that? Patients aren't going to change." And I said, "I believe they can. We're just
Yeah.
not doing it in the right capacity, in the right way." And I've proven him wrong because
Yeah.
I've seen my patients. You talked about getting off of medications. We deprescribe in lifestyle medicine. We're able
Oh.
to reverse high blood pressure, high cholesterol. In fact, this week, there's a new ICD code that is diabetes in remission. And I was actually able to code that this
Yeah.
person had type 2 diabetes, and through healthy lifestyle changes that have been sustainable, they no longer have diabetes or not on any medication. And I coded
Wow.
that diabetes in remission. It was a win.
And then you let them know. You said, "Hey, patient, this is a massive win."
Totally. And when you talk about provider satisfaction and patient satisfaction, again, both very, very important. And
Yeah.
we, like many professions, there's a lot of burnout going on. Medicine has really changed a lot.
Sure.
And I'll tell you what, this is like the best antidote to burnout is that I actually feel like I have tools to truly help my patients. And my patients
Yeah.
are getting better. And I had a patient yesterday who's doing involved in our Cooking for Health shared medical appointment where she comes into the kitchen and it's like a group of 10 people. And she is like beside herself on how happy she is that she actually wants to start volunteering with our program and
Wow.
volunteering in the and because she's feeling great, right? She's feeling great
Yeah.
physically and mentally. She actually
Yeah.
canceled. She was supposed to have L5, so lumbar 5, spinal fusion
Oh, wow.
in 2 weeks. She canceled her surgery because her pain is better. Because she's changed her dietary patterns to an anti-inflammatory diet. She's able to move her body more. We know that exercise for chronic pain can
Mhm.
be really beneficial. So she canceled her surgery. So that's another like reversal, right?
Yeah, yeah, I mean, you can't put that in an ICD-10 code per se, surgery avoided.
Yeah, exactly. But I put that in bold letters in an exclamation point in her note.
Totally. What I just love, I mean, because what you're getting your fingers into and kind of helping patients with, you're coming alongside 20, 30, 40 years of learned patterns, right? And learned most of the time not healthy patterns. And so you're able to come alongside and unpack that, but
Mhm.
also kind of give as much information and as much guidance as possible with your whole team. Obviously, if it was just you running this from your own clinic, you'd get super taxed. But
Yes.
you have this whole system kind of built out now,
Mhm.
is what it sounds like.
Yeah.
And it's very comprehensive, right? You gotta hit all the different points where there could be hiccups or them drop offs. It makes sense why you're having success because you're building it for them. How did you have to create this program through your hospital system?
Well, I this is a newer role for me. I came into this
Okay.
role in July, so just about 4 months ago. Prior to that, I was building a consultation service for another healthcare system in lifestyle medicine. So, I was fortunate to walk into a program that really was built for the past 5 years, and the prior
Okay.
physician did an amazing job, very innovative. So now I'm just carrying that legacy on and building upon that,
Yeah.
and just really, learning from other healthcare systems across the country that are implementing this. So I have colleagues who are in a similar role of a medical director at Kaiser Permanente in
Yeah.
California, UPMC, so University of Pittsburgh Medical Center. So we
Right.
all just support each other and learn from each other. And our annual conference, the American College of Lifestyle Medicine annual conference, the Super Bowl of lifestyle medicine, is in a couple weeks in Dallas, where we sold out. So it'll be over 2,500 professionals coming together.
Cool.
And what is so beautiful right now and will always be, I believe, in lifestyle medicine is the medical system is very hierarchical, and that's how the training is. You start off as a
Mhm.
peon, first year med student, and then you get to be a fourth year med student, and then you get to be an intern and you get a white coat, but it's really short. So it
Yeah.
signifies like you're
You're
not
not there yet.
you're not there yet. And then you become a resident and you get a long coat. Oh my gosh. But then you're just a junior resident. And
Right.
then you become a senior resident. And then you get your first new job, but you're a new attending physician. So
Right.
like there's very much like respect your elder and which it always should be. I had wonderful teachers and mentors all throughout my
Sure.
career. When I came to lifestyle medicine, because we are newish and we really are shifting the paradigm of healthcare and how medicine is viewed and practiced, we all want this to succeed. So whether you're a luminary, a pioneer of our field, like Dr. Dean Ornish, Dr. T. Colin
Mhm.
Campbell, Dr. Kalwa Esselstyn, if I saw them in the street and I'd say, "Hey, it's Melissa Sunderman, Lifestyle Medicine," they'd be like, "Give me a hug," and be like, "You're doing great work."
Yeah.
So it's very collegial, which
Yeah.
I just adore. Is that it's not it's not competition. We all
Right.
want the same thing. And right now, I mean, we're still in an uphill battle, but we can see that, the direction we're going, and we can
Right.
view the top, and it's like worth this I don't want to say effort, but I mean it's an effort, but
It is.
it's we know we're doing good work getting up there.
What I think I'm hearing, I mean, it's amazing that you guys are still fighting the battle because it's people like you in that community that are going to change. I mean, they're going to change our healthcare system. I think most of our healthcare system at this point, and I've had conversations in the past, we are in the States, I'm specifically talking about, we are excellent at acuity care
Mhm.
and
Mhm.
emergent care. We are
Yes.
excellent. We have perfected surgeries. We are excellent at that. But when it becomes chronic care, we are severely, severely lacking because we treat sick,
Yes.
right? We are very reactive. And the best we can do, I mean, when you're a primary care physician, how are you supposed to spend 15 minutes with a person and solve the holistic
Yeah.
problems that are plaguing them? You can obviously just throw, here's your lisinopril and,
Oh, yeah, that's like the
right.
easiest thing to do is to write meds, right? Quick
Yeah.
and, a
Quick
pill for
fix. See you
as
later.
they say,
We'll see you in a month.
right, a pill for every ill, right? And when we talk about, because always when I was in primary care still, we really were scored per se, and if are we doing preventative work for all of our patients. Now, preventative
Mm,
work and testing and diagnostics would be, all your patients get their colonoscopy, their mammogram, their pap smear, their low
sure.
dose CT scan, which are all very important. Don't, get those, right? They're very important tests. But to me, that's not prevention, that's early detection. So
Sure.
where I start my care is in root cause, right? Early prevention before, a chronic disease even starts. Just as Ben Franklin said centuries ago, or hundreds of years ago, maybe not centuries, tens of decades ago, an ounce of prevention is worth a pound of cure, right?
Totally.
So I would much rather be preventing disease than having to reverse disease. We know that
Totally.
reversing disease is possible, but
It
let's
can
let's start way upstream, right?
It can happen. Yeah, and totally. And I love that we can get to the root of that. Now, how do you, I'm kind of shifting gears a little bit, but how do you see, obviously, we've talked about the approaches that your clinic is doing. How do you implement kind of one of your specialties in, you know, influencing nature and kind of getting patients into nature? How do you kind of meld that along with what you're doing with your patient panel?
Yeah, so you brought up my one of my very important hats. I mentioned that I'm a DO, Doctor of Osteopathic Medicine, and that DO stands for Doctor Outdoors. So
Hey,
I
let's go.
like all my life, I have just nature's been so valuable to me and such a source of inspiration, of care, of compassion, of wellness. I
Mm-hmm.
spend every day at least some time outdoors. In fact, I ran very early this morning because I had a very busy day, lots of work meetings, and it
Yeah.
was raining. It was cold. I had my headlamp, and I told my husband I didn't
Yeah.
see a single other person out there. But you know what? I was out there and I
Yep.
finished that run, and I like had a great run of I felt really good, and I was like, I am ready for the day. Like, let me get out of these
Yeah.
wet, soggy clothes, but I am ready for the day. I just had a great attitude. My body felt so good. I felt alive because there was rain going in my face. um, so I started digging into the research of like, why do I feel so good when I'm outdoors? And this was
Yeah.
maybe in 2021. And I uncovered all this research. Like, oh my gosh, this is real. And so I
Yeah.
submitted a proposal to the American College of Lifestyle Medicine to give a talk. And I'm on the planning committee now, and I see how
Okay.
competitive it is to get a talk at ACLM annual conference, but I
Yep.
did. And so my talk was on the main stage at this huge conference, so thousands of people in the audience. And
Yeah.
I went right after Dr. Dean Ornish spoke. And I'm thinking, oh my goodness, well, the good news
Woo.
is that I'll have a full audience because they're all coming to see him. He is just a pioneer, a brilliant luminary for all of medicine and especially lifestyle
Yep.
medicine. And I started talking about nature's medicine and the therapeutic benefits of connection to nature. And afterwards, I had a line of people coming up to me, which I've never had before. I'm like, who are
Wow.
you waiting in line for? Wait, me? And so because of that positive feedback and interest, I formed something called the Nature's Medicine Committee for the American College of Lifestyle
Mm,
Medicine. I'm the founding chair. Founded
very cool.
that about 2.5 years ago. we meet monthly via Zoom. I bring in speakers from all over the world, and I have people attending from all over the world. So I have physicians
Wow.
from Singapore, from Australia, from the UK, like all over the world, which has just been wonderful. And, experts in the field, whether that's
Yeah.
research, whether that's, forest guides or using as
Right.
ecotherapy or other clinicians. So really just right now, one of my primary goals is to educate and
Sure.
it's not only just educating my patients but educating clinicians.
Totally.
I do a lot of speaking, so if you're looking for a speaker, anyone out there, I do a lot of speaking. I love public speaking. And for instance, when I speak to healthcare audiences, and I was just out in California a couple months ago speaking to Kaiser Permanente, their
Yeah.
lifestyle medicine symposium. So it was a whole room full of clinicians interested in lifestyle medicine. And I always start this type of presentation usually with two questions. One, raise your hand if you intentionally spent at least a half an hour in nature yesterday. And people raise their hand,
Yeah.
and then the second question is, if you are a clinician that sees patients or clients, raise a hand who is actively prescribing nature to their patients. And I usually just get a few hands. So, yeah. So, and again, this is an engaged audience that already is aware of lifestyle medicine. So,
Sure.
really, a lot of my work right now is just trying to educate that this is a benefit, right? And I have some of my slides are, they look like pills, but the pill is full of either forests or blue
Yeah.
spaces. And I'm like, these
Yep.
are some of our most powerful prescriptions. And I always back up with data, with evidence, right? Because I think
Sure.
that sometimes people think she's just a tree hugger, she's just a hippie, which I kind of am. I am. Yeah, my
That's
kids,
fine.
I know my kids tease me. They're in their 20s and like, you're such a hippie. I'm like, I love it. So I back it with research, and there's profound research coming out. And even talking about longevity, and we're seeing elongation of telomeres, reduction in biological age with just more frequent visits to green
I
spaces.
love
We
that.
see
Yeah.
boosts in immune system and natural killer cell, reductions in cortisol. Like, I mean, just fabulous just by getting outside. And it's not
Yeah.
like you need to, I would live in a yurt if I could. I love yurts, but I don't.
One day.
One day. But the nature dose is really about 20 to 30 minutes per day, right? It's not
Really
crazy
not that
amount.
much. Yeah.
And I love this one study that I showed that they looked at immune system natural killer cell activity. And natural killer cell activity is not just preventing you
Mhm.
from getting sick, but it's also inflammation and like
Mhm.
cancer risk, right? We want to have a
Yep.
robust natural killer cell activity. So one of the studies was they brought individuals into the forest for a couple days. They saw this great increase in natural killer cell activity. Then they went back home and they still measure that natural killer cell activity 1 week out and 1 month out. And
Okay.
even 1 month out, there was still an elevation from baseline of natural killer cell activity. So just
Wow.
going outside today, all these listeners, if you haven't been outside, go outside today, preferably at least 20 minutes, and you're going to boost your immune system for the next month. I don't have
Crazy.
a medicine that
You're
does
cute.
that.
No. No, none of us do. That's our natural body.
Yeah. Yeah. Yep. So
So
it's
cool. And so
I
what's
teach
your
more
what
about this.
yeah, you're just bringing in a new facet. I mean, this is like the lifestyle medicine world is just learning about this and you're kind of the pioneer of bringing this up to everyone. I mean, some people are lucky enough to live closer to those spaces where they can be outside in nature and away from the roads and the busyness. Some are not as lucky where they live in a more urban environment.
Yeah, but even then, I've got research for that too. There's even just like tree-lined streets, right? So in Louisville, Kentucky, large city,
Yeah.
and they did a study where they planted a bunch of trees in the city, and the individuals who residents were closest to where those trees were planted. Nothing else changed about their lifestyles. They didn't start going plant-based. They didn't start like jogging every day. They
Yeah.
didn't start meditating. All that happened were that there were some trees like around where they lived, and their C-reactive protein levels decreased by 19%. And
Oh
C-reactive
my
protein
gosh.
level is a very sensitive marker of inflammation.
Sure.
So Barcelona is planting thousands of trees because we know that
Mhm.
just having trees in urban environments lowers the temperature. So in cities that can get very hot in the summer, and then
Mhm.
also helps with carbon sequestration. So it improves air quality. We know that poor air quality can be associated with increased risks of strokes. And then I do share also research about virtual nature. So whether that's
Okay. Tell me
listening to
about that. Yeah.
nature, yeah. So I share a study where people listen to 6 minute sound bites, either of birdsong
Okay.
versus 6 minutes of traffic sounds, so horns and sirens and loud.
Yeah.
And they found that people, when they listened to the bird song for 6 minutes, they had lower feelings of anxiety, lower feelings of paranoia, and those loud traffic sounds increased risks feelings of depression. So I say if you can't get outdoors, maybe you could open your window and listen to birdsong. Or if you can't do that, just go on YouTube and like nature sounds and put your earbuds in.
Or
There's
just
also
find a little park. Find a park.
yeah,
Everybody's got a park. There's a park nearby.
totally.
They have
Totally.
trees.
Yeah. And so, and even in big cities, I show pictures of, Central Park and the Boston
Yep.
Common and, just tree lined canopy streets. Looking at nature, there's a very famous study that was done in the 90s about individuals who had just had their gallbladder out. So post
Mm,
cholecystectomy. And
yeah.
they all had private rooms, and all the rooms each had a window. Half of the subjects' windows faced some form of nature. Maybe it was a couple trees, maybe it was a courtyard, maybe it was some flowers, and the other half had a window, but it faced a brick wall. What
Okay.
they found were the patients that had a window viewing nature had shorter hospital stays.
Mm,
The ROI on that is very good.
yeah.
Less pain medication, and
Oh.
the nurses' notes had fewer negative evaluative comments, so they behaved
Mm,
better just by having a view of nature. And then
wow.
also some studies about virtual reality nature. So where I live in Ann Arbor, the University of Michigan has huge
Mm,
hospitals, and they have 3 of what they call recharge rooms, and you go into these rooms and an entire wall is projected with nature and the sounds, and it's like you can select where you want to be. Like, do you want to be on a beach in the Caribbean? Do you want to be on a mountaintop? Do you want to
yeah.
be, like on a pond? And so there's music, there's nature sounds, you're looking at nature, and we know that that can increase heart rate variability, it can
Yep.
help with our cognitive restoration. So a lot of ways, when you can't get the real thing, you can do virtual reality, other forms of nature, which are beneficial.
You're reminding me of like exhibits at a museum or something like that. This virtual reality, when you go to, obviously, most of them are at national parks. So that's already like an entrance to the outdoors. But I'm thinking of like big museum systems. If you go into certain exhibits, like you can listen to the noises that the certain animals are making, or
Yeah,
you can kind of
yeah,
be immersed in those little rooms where they have, just nature sounds
mhm,
of what it would have sounded like. I don't know if it's a history museum, what it would have sounded like
mhm,
150 years
right?
ago, that kind of thing. Like, you're reminding me of those. And that is, you always leave a museum, or at least I do. And I'm like, wow, that was so cool.
Mhm,
Man, just really got to experience something cool. You never
yep,
leave feeling more depressed or
right.
anxious.
Yeah, and
I didn't
that's
even
what I
think of it
say with
until you
like
brought that up.
yeah, absolutely. And so when you asked about how do I integrate this into prescribing, first off,
Yeah.
and why I'm like such a loud voice and I won't stop talking about it is to clinicians because we already have studies that show if clinicians exercise themselves, they're more apt to
Yeah.
prescribe exercise to their patients.
Yep.
My feeling is if I have clinicians that engage in connecting with nature, they're more apt to prescribe this. And
Yeah.
there are some great programs that are growing. Park RX America, Dr. Robert Czar and Dr. Stacy
Uh-huh.
Stryer have pioneered this. Any clinician can register to be one of their prescribers, and then you get access to their dashboard. And so I'm in Ann Arbor, Michigan. If a patient comes, I'm seeing a patient and I say, "Where do you live?" I plug in their address, and then up
Yeah.
will pop maybe Metro Parks near them, a state park near them, and it looks like an actual prescription pad. And I say, "Okay, it
Wow.
looks like you're going to go to let's have you go to Huron Meadows Metro Park. That's only 5 miles from you. What days do you want to go? Oh, you want to go on Monday and Wednesday. So Monday and Wednesday, what do you want to do there? I want to hike. Well, which trail should you do? And so, like, literally, I will do a
Wow.
prescription for them, and then they can get email reminders or text reminders. So it's treated like a prescription, which there's some people who think why would that medicalizes it too much, but in right now sometimes people need that. They need, like,
Yeah.
okay, I don't
It's
want a
true.
pill, so like give me a different prescription. I'm like, okay, I'm giving you a prescription for nature, and they're like, okay, this is real. Like, this doctor is giving me a prescription for nature, so I'm going to
Yeah.
follow through and be compliant.
I feel like you have so much to share about this because you're kind of the pioneer in this way of prescribing it and really making it like, hey, so you saw me in clinic today. Here's your prescription to go do this,
Hmm.
right?
Hmm.
People are even more apt. I mean, that's what we've been trained to do in the medical field, and that's what the patients are trained to follow. If they give me direction, I go do it. If they
Mhm.
give me an antibiotic, I take it for how long it says.
Mhm.
So if you're giving them the prescription, they can follow that. Since you have so much data and like knowledge, and obviously you're continuing to learn about this, is there a way that you've tried to consolidate all of your ideas? Hint, hint, in writing.
Well, yes. Funny you should bring that up. My debut book, Dr. Outdoors Guide to Nature and Lifestyle Medicine, was just released about a month ago. It is available
Very
on Amazon, so get your copy. So I share a lot of the research that I've just talked about, and then I integrate it into the pillars of lifestyle medicine. So eating closer to nature,
uh,
moving your body in nature, sleeping better with a connection to nature,
sure.
and reducing stress and how to connect. So, and then just some practical tools about how to integrate this into your own life. So, super happy and proud about that.
And how has that been your passion project for a while now to create something like
I
that?
never thought I would ever write a book. Again, like my career, and this is like for anyone listening, you never know where your career is going to go. I would have never dreamed I'd be talking about nature and be Dr. Outdoors even like 5 years ago. I just like it, just, I think that in life is, you just be open to the universe and just,
Yep.
and one of my mantras to myself is the universe has a plan for me, and I will say I'm 55 right now, so some of those chapters I'm like, "Universe, really? Like, really? Did I have to go through that chapter?" But,
You
but
had to learn. You had to come from a
yes,
position
you
of learning.
learn, and I think to remain curious, right, and
Sure.
open and make connections,
Yep.
and it's just been a blast. So I can't believe that I wrote a book because I was the kid in, the college student who was like, okay, give me a Scantron test. What do you mean there's a blue book? We used to have blue books. This is
Yep.
before
I remember.
computers,
No, I
right?
remember. I remember.
There are blue books. So you'd have to get like and then you have to write. And I'm like, oh,
Yep.
this is not me. But, then I found something I was passionate about. And
And
then
then
I
it
was like,
started
writing
flowing.
a book. And people, what has started happening, which I'm I've done this like just grassroots. So I leverage
Sure.
social media and the free power of social media like crazy. If you follow
Yep.
me, I do like little reels with my phone. I like right after a run, like no makeup on, just talking about this stuff. And so
As
people,
is.
yeah, this is how this is what I want to show up authentically, right? And
Sure.
so people started saying to me, like, I want to learn more. When are you going to write a book? And I was like, write a book? Write a book?
Mm,
And then I was like,
mm.
I'm going to write a book. Yeah.
I'm gonna
So,
do this.
yeah,
What I
exactly.
love is that you're being flexible to the opportunities that are coming your way. And I
Absolutely.
think obviously you're also presenting yourself as open for these opportunities so that when they're knocking on your door, you're not turning them down, right?
Right.
You're leaning into it. You're leaning into these situations where it could be very easy to just stay where you're at. You have your boundary lines already drawn.
Yeah. Yeah. Well, and it's like getting out of that comfort zone. Like, I'll tell you, to be honest, like I was speaking at this global longevity summit and I looked at the speaker lineup and I was like, "Oh, boy, I'm having a little bit of imposter syndrome."
Yeah,
And I was like, okay, you know what? Just talk about what you do, right? And
sure.
don't try to be someone else. Don't try to like, because there was like when I was pulling citations, I'm like looking at the PIs, the primary investigators, and I was like, oh, they're speaking at this conference. Like, that's not going to be like my lane is to talk
Right.
like to didn't share research, but I'm like, stay in my own like where I am, but get
Hmm.
out of that comfort zone, get on that stage and own it.
Yeah,
Even though,
exactly.
it's like beforehand, just taking my deep breaths. And then you do it and you're like, okay, I did it. Like, yay. So I
Yeah.
think that always looking to get out of that comfort zone because it's really cozy in there. But
Yeah.
growth doesn't happen when you sit in that comfort zone. So put yourself in what, every day, just little things. It doesn't have to be jumping off a cliff, but just edging towards that challenge zone of trying
Right.
something new, trying in a
Right.
different way, and continuing to learn and, yeah, be 1% better.
And that's it. If you're 1% per day, honestly, even 1% a month that
Yeah,
you're improving, like that's showing growth, like you're attempting to
absolutely.
grow. So obviously we've got your book, Dr. Outdoors on Amazon. We've got you plugging in on social media. I'm assuming the normal like Instagram, Facebook,
Yeah,
and
so I'm really
LinkedIn as
active on
well.
LinkedIn, Instagram. I've got 2 handles, Motivator Melissa and
Nice.
also the Doctor Outdoors. So Instagram and LinkedIn are really
Yeah.
my places I go. I'm in my mid-50s, so, like, I was late to the TikTok thing, so I can handle Instagram and LinkedIn.
Sure. And that's where if, I've got listeners in other states, kind of outside of Michigan
Mhm.
specifically, that's where they can kind of connect with you and follow up on what you're doing is what I'm asking.
Absolutely, and there's some really exciting programming that I'm working on. One of them is something called Reciprocity RX,
Okay.
and this got born because I heard about an amazing woman. Her name is Sydney Williams, actually one of the past presidents of the American College of Lifestyle Medicine, Dr. Wayne Dysinger, who's a amazing human,
Yeah.
pioneer of lifestyle medicine. He went on a retreat. He called me and he's like, Melissa, you need to meet Sydney. So, about 2 years ago, I had Sydney as a guest speaker for the Nature as Medicine subcommittee, was blown away. She wrote the two books, one, Hiking My Feelings, and then second book is Hiking Your Feelings. And basically, Sydney reversed her own type 2 diabetes and improved her overall mental well-being through connecting with nature and moving her body in
Wow.
nature. And so I asked her to come back and speak probably about 6 months ago. I talk about nature's medicine, right? So connecting with nature and reaping all the benefits of nature. But let's flip that. And how can we give back to nature? Because if we want to
Sure.
reap the
Oh, good
benefits
point.
of nature, we got to make sure it's still there and linking this to planetary health. And my feeling is the more that we connect with nature, the more that we're going to respect nature and the more that we're going to want to take care
Hmm.
of nature. So Sydney gave a great talk about reciprocity, and then that turned her light bulbs on. And she said, wait a minute, what about if we come up with a curriculum called Reciprocity RX that we can bring clinicians, healthcare, or any kind of healthcare provider or anyone
Yeah.
through a certification program that they learn about Reciprocity RX? So they learn about the science of nature, but then Sydney brings in a lot of reciprocity. She does a lot of work with public lands.
Oh,
And
cool.
so we are going to be launching, well, she's going to be launching it. I'm going to be a facilitator. So
Sure.
there's an open house on November 12th. It might be after this airs, but that's okay. They still can
Very
find out
soon.
about it. Reciprocityrx.com. And so
Okay.
certification program, and then it's going to culminate in a retreat the end of June in Cascades in National Park in Washington, where we'll integrate all of this. So again, just finding people who share a similar passion, who are doing really cool and wonderful things for not only humans but also for the planet. So that's just another
So
project that I'm excited. And then one last plug.
keep plugging.
Okay, so something called social prescribing. Have you heard of social
Okay.
prescribing, Ben?
No, tell me more about it.
Okay. So social prescribing is very robust and it's been around in the UK, Europe, Australia. And
Okay.
social prescribing, one of the quotes is, instead of asking patients, what's wrong with you? You flip it and say, what matters to you?
Mm,
And social prescribing would be prescribing things like nature, prescribing
okay.
things like the arts. So maybe a art class, a painting class, a music class, prescribing some form of exercise, taking a yoga class, joining a biking group,
Yeah.
prescribing volunteerism, service. So
Hmm.
I'm a newly appointed advisor to Social Prescribing USA. We just had a leadership summit in New Jersey about a month ago, convening thought leaders across all different
Hmm.
disciplines. So the arts and nature and physical activity about how we can integrate this into our healthcare system flow. And
Okay.
one of the key members there is something called a link member or a link worker
Yeah.
that would work with the clinician to be like, okay, in your area, these are some of the, nature ways we can prescribe nature. Here are some like arts we can do. Here's some physical activity. And so we're able to prescribe things other than medications. And we know that a lot of times, like lack of connection, being socially isolated and lonely,
Yeah.
what studies suggest is that that can be a health risk equivalent of smoking 15 cigarettes per day. So we really have a loneliness epidemic. So
Oh, yeah.
social prescribing and getting people to connect back to themselves and to others can be very,
Hmm.
very powerful. So just a couple of things that I'm also working on.
No, I love that because I don't know if that's a reflexive or that's born out of the COVID kind of pandemic. But even before then, we were already seeing clues of people just having really kind of loneliness really taking over. And honestly, probably in your speak, being the root cause of a lot of chronic
Hmm.
illness or leading to that, right?
Hmm.
And so addressing that with social engagements is obviously ideal. I mean, if you can just get somebody, even if it's something that they're interested in, right?
Yeah.
It's not like, hey, I'm asking, you know, an obese person to go, hey, you need to get on this half marathon training group. It's
Right,
it's not
right.
that.
Yes, it has to be. We need to meet individuals where they're at
Yeah,
all the
exactly.
time, right? And provide other modalities of healing besides just take this pill.
Exactly. And
And
so
I
you're
and
giving
that
them
being
those
said,
opportunities.
it's not that I don't prescribe medications. When I have someone who's got blood pressure through the roof or a hemoglobin A1C that's too high, yes, I absolutely will utilize medications. And
Yep.
I'm doing other prescriptions in
Well,
addition to that.
you're actually delving into the lifestyle
Yes,
modifications. And
absolutely.
that's where we come to the full circle of
Yes.
lifestyle medicine, and what you're doing is just amazing. I just love how you're trying to connect every little facet that you can to overall. I mean, it's not just the physical well-being; it's the emotional
Yeah,
well-being as well. It's helping the holistic view of the person
absolutely.
and treating them as a person rather than a patient is what it sounds like.
Yeah.
So
And you know what? I'm getting to have a blast. This I love
I'm
being in a
sure the listeners can hear it.
yeah, I love being in a, career and a profession of service, and it gives back tenfold to me. So,
Yeah.
yeah.
Yeah. Love it. Well, I think that's all we got for today. I really appreciate you joining. There's plenty of ways for people to find you and follow you and reach out. I'll be putting this on, and hopefully the listeners continue to kind of follow up with what you're doing, because it'd be so cool to just see how this progresses over the next 5, 10 years.
Yeah, exactly.
So
Thanks for having me. This has been a fun conversation.
thanks, Melissa. Thanks for your time today. Bye bye.